Good morning, Dr. Alessandro.
Good morning.
Thank you so much for having me here in your beautiful practice in Switzerland.
We just had a walkthrough that we will share also with you from the dental office, because Anna caught me when I was recording my morning routine videos. So with my studio setup that you just saw. Did you like this?
Let me tell you something. This looks insane. I have never seen anyone having more toys than Dr. Alessandro. You like your toys, don't you?
Well, I'm a gadget lover since the very beginning. I explained to you that I opened my office in 1990 when I was 20 years old, so at a very young age. And I started immediately using the CEREC system. At that time it was something out of the world. I remember when dentists were asking me, what are you doing in your dental office? And I was like saying, I do CEREC. And then they were like waiting a second, say, and what else? I say, no, I'm doing CEREC. So basically still till today, my dental office is almost 75 or 80% of what I'm doing is done with the help of this machine.
You were also a pioneer of, you were one of the pioneers doing this overall in Europe, in the world. Maybe you tell us something about how did you start and how did you become a pioneer of using such a developed technology?
Well, becoming a pioneer, you have to be in the right place at the right time. So this is no fancy things. I was a student in 1985 when Professor Merman talked to us students presenting this CEREC technology. He was like saying, dear students, imagine you, your patient, and the machine working together. And I was like, wow, fascinated by this, and said, this is the future. This is the future that we, as a dentist, with the patient and the machine, can get the best result at the chairside. So the concept started called chairside dentistry, which was not so popular. Still today, most of the dentists are prepping their teeth, taking an impression, might it be a physical one or a digital one, and sending this to the lab. The lab technician is producing the restorations, it comes back. So this means always 2 sessions, more time, more stress for the patients. And so my concept of doing everything in a single visit, this was the idea behind the whole concept of CEREC. And for me it was obvious, this is my way to perform dentistry. Although you might say, well, if you do everything yourself, you're a dentist, you're not a lab technician. The machine developed over time, but does it really compete with a lab technician? No, it's not a competition, it's something completely different. And I have seen over the years that also our patients have changed. The demand of the patient has changed. Today, at the end, most people in many countries, we have differences, cultural differences between America, Europe, Asia, and so on. But basically everybody wants nice looking teeth. They don't want fancy colorations, they just want to have a bright smile. And this can be delivered with this technology. Let's say going down a little bit, or this fans of this effects in the ceramics and so on. But at the end, if you ask the patient, they just want to have, when they smile, it has to look nice and bright. So basically this is the future. And with this change also in our patient community, these technologies make even more sense, because they deliver a good quality dentistry that is not the 200% aesthetics of a 10-time tried in single tooth on the front, but it's something that quality price is unbeatable. And this is what we see. We have more patients also struggling. Not everybody can afford $100,000 smiles. This is a very small percentage of the patients that are really able to invest a car in their mouth. What we see, and this is always 99% of dentists are single tooth dentists. A patient comes in the office, has a problem on one tooth, and we have to solve this problem, and not the patient comes in and I say, Anna, we will do a smile design and then we will do 28 veneers or we do 28 crowns, or we do whatever you want. And then you ask me, okay, wow, I like the idea of having beautiful teeth, but what's the downside? What are the costs? Sorry, what do I need to pay for it? So at the end we see, especially like in countries in Switzerland, if you tell a patient, I will cut down all your teeth and create you a beautiful smile, they will ask you, but I don't want you to touch my teeth. So minimal invasive dentistry is something that is getting more and more important. And minimal invasive really means try to touch your teeth at little as possible. And this goes then in the opposite direction of what we see in some parts of the world where they say, we don't care, we just cut down teeth because at the end we have to deliver immediately the most beautiful smile and costs at any cost. And on the other hand, we have a growing population of patients who say, well, I want to keep my teeth until I'm 80 years old, 90 years old. If you start touching them too early, in the 20s, you do already a full reconstruction. Even if you're the best dentist in the world, I don't believe that your crowns will last 50, 60 or 70 years. So this is basically my idea, my vision, and I see that more and more dentists around the globe are sharing or following this trend of being less invasive, helping our patients, and not just seeking only for money. Money is a problem. Money is always an issue. We need the money to run our offices, to feed our families, to go on vacation, to buy us our gadgets, as you see here, but it should not be the main focus and the main goal. I always say if you do something with passion and love, at the end it will also be economically interesting for you.
Absolutely. You touched a very delicate topic, which is minimal invasive dentistry. You said that there's more and more dentists striving for minimal invasive dentistry, which is a great, amazing thing. And what would you say are other qualities that a good dentist, innovative dentist, modern dentist should possess, in opposed to what you just mentioned about dentists that are cutting teeth too much, that are businessmen that think about money?
Well,
only.
The most important thing, and this goes a little bit beyond dentistry, is to be a good communicator. If you are the best dentist in the world and you're not able to communicate with your patients, you will be not successful. On the other hand, you can be like a so-called bad dentist, but a great communicator, a great marketing person, and you will be successful. So that's reality. And this is also something that a lot of people are like struggling with. They say, wow, look at my work. My work is high class. I have top-notch quality, but I'm not having the success with my patients. I'm not invited to conferences, you name it. So you have to work also on your communication skills. It's how myself, how others out there talk to their patients, how you listen to your patients. So this is also an important fact. Don't just say, okay, we can do this and this and this and this. I remember a story that I'm telling in regard to this is, imagine you're going into, you have to go to the toilet, and you are in a street in Zurich, and you say, okay, and now I will go into the Louis Vuitton shop and ask if they have a toilet. So you go into the shop and say, welcome Anna, can I show you around? We have new bags, we have new shoes, we have this and this and this. Please take a seat. And they show you the whole collection. And after a while you say, sorry, I just have to go to the toilet. So the patient feels like that. If you start immediately selling something, start listening to the patient. So if we have a new patient, we take the time to listen to the patient about the complaints. And if a patient, for example, starts like talking bad about the other dentists, and sometimes they say, I visited 5 dentists over the last 10 years, then you say, oops, be careful. I'm number 6 or number 7 in this row. Listen first what the patient wants to tell me, what she or he wants, and then starting from there, start talking. And it might end up that you say, well, I think you should look for number 8. I was number 7. Just look for number 8. But I'm not the right person. I'm not the right dentist to work with you. So this is also an important thing. It's about communication, about relationship. So we try to build up a relationship with our patients. You saw that yesterday, that we have a lot of happy patients that are enjoying the time here, that they enjoy that we take the time to talk to them, to ask them also about private things. It's a full package that you need to deliver. And for sure, you also need to work on your skills to improve the skills. So my thing is always, after now 34 years of practice, my goal is to really still be better in what I'm doing, and not just say, oh, I was so good 20 years ago and now, okay, I'm just going down with the quality.
Or stagnate.
Yes, yes.
As a dentist, you can never stagnate. You will never stop learning. You should never stop studying and improving yourself. Do you agree?
Absolutely, absolutely. Never stop learning is not just a word. This is reality, and this applies not only to your profession, this also applies to your private life. So you should learn from the mistakes you have done. And this is what we see now also globally. We have the global community made mistakes over the last thousands of years, and we continue making the same mistakes again. So maybe it's that because our life is limited. You're here, you're a child, and then you start having an impact on your community when you are an adult. So let's say you have 30 years or 40 years max to have an impact on the community, and then you retire, and then it's the end of your life. So, but we should sometimes think, what can we do in this short time we have? And again, I think every day you should try to not fall into the trap of in this hamster wheel. Many dentists are like in this hamster wheel. They opened their office, they go into the practice, they work the whole day, they go home, and at the end they feel like frustrated because they don't know what they really are doing. And we see also in the dental community a large number that is unhappy with their profession, but in comparison to others. Imagine, you have invested 1 million, 2 million, you have invested, if you're in the US, you have invested 1 million in your education, you have invested 1 million into your office, you start your business, and after 5 years you realize, oh, I think I want to be a designer, I want to be a carpenter, I want to be whatever, but I don't really like my profession. You don't switch that easily because you have to give up something. You have still maybe loans to pay back, and then maybe you have a family, you have everything. So you know, oh, I need a certain amount of money each month. How can I stop this and switch to completely something different? And then they start thinking, and they continue with this boring profession, just because they know, okay, I can make a living with it. So this is a frustration we see, not only in the dental profession, but this is something bigger because you have an investment, you have your backpack, that you have the money you have to pay back. And you know, if I switch to becoming a carpenter, maybe I will never be able to pay back my loans to the bank. So these are the things. But I think when you start your business, when you are a student, you already should think about, is this really what I want? Is this really what I want to do for the next 30 years? Because it's a decision. It's not something that you study and say, okay, now first I do it. I travel around the world and then I will find out what I really want. If you become a doctor, if you become a dentist, let's say some steps in your career are given. You can, there's some turnarounds, some ways to, let's say, changing a specialization, going in this or going in that direction. But basically, you're a dentist, and you will be a dentist. You don't become a dentist and then start fixing cars. You know, so this is that we know that we are in a field that is very narrow, and maybe that's also the reason why a lot of dentists are very narrow-minded, not open to new things, not open to changes. So they keep running in their hamster wheel, and we want you to step out of this and think about having more fun in what you're doing.
You said that we can prevent from getting into fixed routine by thinking of your future early in the beginning of your career. But let's say we already started our careers. What would be your advice to how to get out of this, as you called it, hamster wheel?
First step is you have to realize that you're in the hamster wheel. So this is the thing. A lot of people don't know that they are trapped in their daily routine. So they just, after a while, they say, well, this is normal. This is my normal life. And they don't realize, or they realize too late, that there's an issue. And this is the problem also. I always say all problems in the world are communication problems. Be it a relationship in a family, be it a relationship in a dental office. So if you wait too long to realize that there is a communication issue, that you're not expressing what you want, what you need, then it might be too late. Too late that you say, okay, now I need professional help. And then this professional help is saying you, look, you should have made decisions 5 years or 10 years earlier. Now we have to check what can we do to fix this problem. The longer you wait, the more difficult it will be to change the situation. So that's why from time to time, just take some time off, or go outside, walk around, and just think, what am I doing? Leave your smartphone at home and just go out, breathe deeply. And sometimes it's also good to be alone. Just walk through the wood or in a quiet place and just reflect a little bit. So this is also, a lot of people call this then meditation or self-reflection. You can name it as you want, but at the end you need to stop. Someday you need to stop, because otherwise time is running, your life is running, and you don't realize. So you need to say, okay, now let's take a break. Let's step out. Let's step out of yourself and look at yourself, and then you will find out, well, I enjoy what I'm doing. I'm not enjoying what I'm doing. And then maybe you can also write down what are the points you want to improve, change, and then the change. This is also like maybe a metaphoric. The change always starts in your head.
Great, that's a great advice. Thank you for that. As you mentioned, we should think about how we want to drive our careers on the early stages. How was the beginning of your career?
Well, the beginning of my career was really, let's say, a little bit fancy or strange, in the sense I worked with another dentist, and the idea was that we will collaborate, so that I enter in it as an associate in his office. We might expand it a little bit and run it together. So, and I told him, look, the location we have is a little bit too small, and I was like watching out for other possibilities. And then this building where we are now in was about to be built. And I was telling him, look, I have already organized a large space where we can start our business and even have the space or room for developing further. And then he came like, well, he was 50 years old at that time, saying, Alessandro, I'm not sure if I really want that. So if you want to do something, just do it by yourself. So I already had pre-ordered all this stuff. And so at the age of 28, I decided to say, oh, okay, if he's not joining me, I will do it just by myself. So I ended up with a huge office with five rooms, with a lot of equipment. I spent so much money, useless, because I trusted specialists who told me, look, Alessandro, in a modern dental office, you need this. I made a calculation some years later. I spent 150,000 Swiss francs in equipment I never touched once. And at that time, I had to pay 10%, say mortgage to the bank. So imagine if you have like, we also bought the property. So I had around 3 million Swiss francs of debt, 10%. So I had to make 300,000 just to pay the bank. And that in these days, when I started my business, I really worked from almost 24 hours a day. My wife had to go to work also, that we had enough money to get to pay the rent for our apartment. We also had 2 children, so we did everything just together, and I never missed that time where I really had to work so hard to start my career, because again, time was flying. The days were flying, the weeks were flying, and I enjoyed the time. I was lucky when I opened my office that in this area there was potential to attract new patients. Would be much harder these days, and so the business grow without really thinking too much about it. So I just followed my passion and had a big support of my wife and my family. So this is also a key element. You need support, especially the number one social network you have is your family. And again, this is some people are lucky to have a good family, others have the bad luck to have, let's say, more a complex situation in their family. But this was the most important support, was really my wife and my family.
That's great. I completely agree. You are very, you have a lot of courage to do it on your own. You had a lot of courage. You have a lot of courage. You had amazing support, as you said, and here we are. In this amazing office, running smoothly. You're running on your own. It requires a lot of courage, a lot of passion, a lot of love towards what you do. But is there something that you'd change in the sense of in your career that you would do differently?
Well, I don't think so, because when I was 18, my idea, I wanted to become a journalist. I was not thinking about becoming a dentist. And so at school, I had 2 friends, my best classmate and the girl that was also in our class. The girl had a father who was dentist. He was a professor at the University of CEREC. My classmate was telling me, I want to become a dentist because I want to make money. And at that time, in the end of the 70s, beginning 80s, there was like the golden age of dentistry. I remember, especially in Germany and other countries, dentists were like overwhelmed by work, and you know, the prosto work really raised, and they really made money. Over the last decades, things have gone down because we have also the results of our preventive measurements. So I see it also in my office. We have more people with less problems. So the younger generation who takes care of their teeth much better. So they brush their teeth, they do all this, they have ortho treatment so the teeth are straight, easier to clean. So the number of, let's say, less invasive dentistry, doing more composite fillings rather than doing CEREC restorations or veneers or crowns, this number has increased. So the result of this is we have to do more for the same money, because a composite filling still is paid less than a crown. And if you do a composite filling the right way, it takes some time. It's not that it's done in 5 minutes. So At the end, if I do one CEREC, I have to do like 3 fillings for the same money, but 3 fillings takes me much more time than doing one CEREC restoration. So this ends up that you are making a compromise, getting less income, but again, this is reality, and this is the way our profession is going. And I remember we had a professor, Mühlemann, who was one of the pioneers in prevention in the 1960s, and he was telling us, dear students, you know that what we have started in the 1950s, 60s, telling our population how to use fluoride, how to brush their teeth, how to eat less sugar, to have their teeth for a lifetime, that this will make our profession useless. So we basically are working, our goal, our final goal would be that the community doesn't need us anymore. Maybe you need an orthodontist, you need a dental hygienist, you have to do small interventions. It's not in that extent because people are lazy, they don't brush their teeth, they lose their teeth, and so on and so on. We know the story. But basically, we see in countries like Switzerland that we have less demand from the population, and that's not a bad thing.
That's definitely not a bad thing. We are striving for less work, basically.
Yes.
Don't we? And it seems that we as dentists, we face a lot of challenges in our careers. We struggle with lazy patients. We struggle with money because we want to invest a lot. We want to educate ourselves. So there's a lot of stress going on around our profession. But what was the biggest challenge in your career?
Oh, I basically was just jumping into it. For me, a challenge. The challenge in the beginning was to have a huge investment, and I knew, oh, I need to pay off. So, but maybe some people would create like a stress situation, say, oh, how can I do that? And I, from the beginning, again, was like a little bit, well, not thinking too much. If you start overthinking, then you say, ooh, how can I do that? It's not possible to do that. And sometimes you really need be a little bit like a child and say, yeah, this will work out. This will work out. So create also like a situation that you stay a little bit. I like also the wording like stay always curious like a child. So children, they ask everything, they want to know, they want to learn, and then the older we get, the less we are a child. And I also wanted, or still want, to keep the child in myself alive and be curious, want to learn more, want to know more. And at the end, there's one thing, I never, in all the 34 years that I have my dental office, calculated at the end of the day how much money I made that day. So you feel it. You feel if things are going good, and you feel if things are going bad, you know. So this is also things. Don't let yourself stress by numbers and things. Okay, sometimes there's a situation where you have to say, I'm not able to do this investment right now, although I want it because of this and this and this. So I'm postponing it to the next year. So these are all the things. But at the end, just don't overthink things. And always have somebody, and this is in my situation, my family or my wife, to speak with, to share problems, and together find solutions. So this is the easiest. This is my way of thinking, of living, and this works out.
Yes, the older you get, the heavier your backpack, as you named it, becomes, and you seem like a very bold person, and very also career driven, but also family driven. And I think that's what makes a good dentist also a good or a good person, a good dentist, and a good dentist a good person. And you build this amazing career of yours. But if you could share maybe one thing, what do you think is a key to success?
Again, the key to success is to never think I'm done. Never think it's like the shortest joke in golf is I can. You know, for me, golf. I used to play a little bit more, now a little bit less, but this is a sport that really shows that you're never perfect. So that's why also a lot of people like watching golf games or these golf tournaments, because they see that even the best in the world fail. And this makes them like human. They're not the perfect. They're not the golf players are not what social media, for example, is representing. Everybody looks perfect, is rich, is beautiful, is whatever you want, and we look at this and say, "Wow, why am I not like this?" And the golf players, they are the best example of. And you laugh when the best players don't hit the ball right or miss something, and then this makes them human, and they say, well, I could have done better. You know what I mean? So it's comparing you with somebody. This is something we like, but I would not say compare yourself with other dentists or always compare yourself with yourself and try to say, okay, what did I good? What did I wrong? And there's one thing that a friend of mine, Rino Burkhardt, was saying correctly. If you do composite fillings every day, don't think that you get better at it if you don't train yourself. If you ride with the bicycle to your office, 5 kilometers every day, so you do 10 kilometers, you do thousands of kilometers a year, don't think that you can attend the Tour de France. You know, you need to train. So if you want to improve, then you say, okay, now I did a composite filling. Let's check what was good, what was bad, what can I do better next time. And this is very important, that from time to time. And this is also, we talked about dental photography and communication and documentation. When we're coming back to photography, one important part in dental photography is also, beside the clinical documentation, also self-evaluation. So from time to time, you don't need to take pictures of all your cases, because it takes a lot of time to do good documentation, good photography. But from time to time, check something and look at it and say, well, maybe the restoration I did 2 years ago was better, nicer. Maybe I was like becoming lazy in some of the steps, and then try to go back and improve yourself again. So because laziness, then you try something. It's like a friend of mine was saying, look, if you're doing a lot of implants, you get more risky. Over time you say, I tried this situation that was not like ideal, it worked out. Let's move the bar a little bit higher, move it higher, and then you reach the point where you fail. That's a fact. And then you see, I have gone too far, but what can I learn from going too far? Okay, I have to go down 5% or change this, change that, and maybe one day I can even reach that level that I failed at the first time with changing some steps, some materials, some techniques, go and learn from others or discuss these issues with other colleagues. This is also something that we should do more. Exchange each other, not just going to conferences and then say, hey, you're a cool guy and I'm a cool guy, but maybe share more also problems and try to solve these problems together.
This networking and sharing your experiences is definitely very important in our profession. And what do you think, do you think having a mentor is also important to your career?
You definitely need to find your mentors when you finish your studies. So basically you find out, okay, my passion is orthodontics. Then check out where are the people that are lecturing a lot, writing a lot. that you could follow or even get in touch with to learn from. So this is, and I think a lot of colleagues around the world are ready to share their knowledge with the younger generation. You just need to ask them. And if you can go, what you're doing now, to visit other dentists and check out what the philosophy is, how they treat their patients, what their concepts are, then you find also out for yourself, wow, I like this approach. Maybe I was just thinking to becoming an endodontist, but maybe I'm switching and doing more implants or doing more this, more that. So this is the time that you need after graduation to find what you like most. And it might also change over time. I know dentists that after 10 years being a protodontist change to becoming an endodontist or change to become an orthodontist. It depends. But just follow some people that have experience, because you cannot buy experience. You have to make the experience. And if some people who made experiences are willing to share it with you, that's great.
Absolutely. You started saying about the photography. I know it plays a huge part in your life, not only in your professional career. Tell us, how did you start with photography? Where did the passion come from?
Oh, my passion for photography started very early. When I was 15, 16, I bought my first camera. I worked almost more than 1 year or almost 2 years at the gas station every weekend to get the money to buy me first equipment. So we had also courses at school to develop the slides. You know, this was the analog days. I also started my dental office with analog photography, obviously. We experimented also with digital photography in the 1990s, but yeah, it was like, so la la. The first step into digital photography for me was in 1999, so 25 years ago, when Nikon introduced the D1. So this was then, I had to promise my wife that I buy a camera only when it's below 10,000 Swiss francs, because 2 years earlier there was already a camera from Nikon and Kodak, but this was 40,000, so a little bit too expensive, I say. And so I started my digital. I still have thousands of slides. So there was like also the transition phase from the analog to the digital photography. But then I started really to take some time to learn what is different in digital photography, and I was lucky that professors from the universities from all Switzerland came to my office to say, we heard that you have bought this camera and that you're taking pictures digitally. And I was then connected with the ITI through Professor Buser and Professor Belzer. And it was interesting. I organized a meeting and then started really traveling around the globe, teaching the dental community on photo and communication. So at that time also a lot of people didn't know how to do a PowerPoint or keynote presentation. I even did courses for dentists how to use email and the internet. So it was a very interesting time when the whole thing started. And now 25 years later we are ahead of this. Basic stuff still is the same as it was in the analog days. We use the same lenses, we use basically the same cameras that instead of having a film have a digital sensor. We use similar lights. We have some improvements in the technology, making the whole process of clinical documentation much easier. So this is in brief. And the passion for photography. Recently I found out that I tested, I would say, 250 cameras over the last 25 years, but really in the dental office. So I took pictures of teeth with more than 250 cameras with all different brands. So for me that was also important, not to, let's say, I also wanted to know not only what Nikon is doing, but also what Canon is doing, what Sony is doing. Now Sony is pushing a lot, being the #1 brand in mirrorless cameras. So this is the latest generation, and if you want to learn more about this, you can also go and watch all the videos on Dental TV to have a little bit of advertisement on the side. So yeah, that's it. So basically I'm trying to share my passion for photography as I was sharing or still sharing my passion for digital technologies, and that's the way to go.
Perfect. So it started from analog, it goes through all the digital times. You keep on expanding your knowledge in digital dentistry, also with photography, and you were involved into development of a lot of great digital devices that we nowadays use. And you also work on a new project. Tell us about Dental TV.
Well, I started Dental TV a little bit more than 2 years ago, basically because we did a very successful dental photography conference in 2019 in Seville in Spain, with more than 100 people from around the world sharing their passion for dental photography. We wanted to do another one in 2020 in Budapest, and you know, the pandemic, we had to postpone. Then you lose the momentum. And so I was like thinking, what can I do now? So I started also being active on social media, which started because of the conference, and now has become something where I'm sharing my passion for photo and video with the global community. And Dental TV was like another thing, because on social media the niche is very narrow, but my vision is a little bit broader than just telling you how to use your camera and how to shoot the film, shoot the movie, or how to create content. I realized there's so many things that we don't know about, not only as dentists. And then I was like saying, okay, let's do something like a Netflix for the dental community. And it's not another dental education platform. It's something, we have a web version, we have an app for iOS and Android, and it really looks like Netflix. It's based on Vimeo, a video platform. And what I want, and all the people involved in this project want, we want to edutain you. So edutainment means education and entertainment at the same time. It's not another educational platform where we just have the course, we teach you how to do an MOD filling, we teach you how to do an endo treatment. No, we don't teach you in the sense that you know, we just provide answers to questions. So we are, the whole platform now has over 400 videos with obviously talking about photography, about video, about marketing, about social media, about well-being, about how to run a dental office, how to eat healthy, how to do this, how to do that. And the content, and I also added now a big part about dental literature. A lot of dentists don't know what to read, where to read, how to read. So we added also this information together with David Elleman and other colleagues to help you, to stimulate you, to say, look, it's really cool to push yourself and think out of the box and learn and never stop learning. So this is the concept of Dental TV, and I hope that the message gets out a little bit more. The goal is, this is really, it costs almost nothing. So my goal was to make it affordable for students, for everyone out there. It's not something that costs thousands of dollars. You can get it for $50 a year. Just ask me, I get you a promo code. I really want to communicate, create a large community that works together. And the concept, how do we create content on Dental TV, is we answer questions. It's not just producing content to have content, we want to answer questions. So basically that's why the videos are not hours, they're very short videos answering specific questions. And if you don't find an answer to a question, then send me a message and we will produce the answer just for you.
Perfect. Thank you so much for this interview. Thank you so much for sharing more about you, about your career, about your path in dentistry, and good luck with everything. Thank you so much.
Thank you, Anna.
Great. Thanks.
Nice meeting you.